So it's a real challenge now with the technologies that we have, because we can do very thorough analysis of the genome. And we see that certain tumors, and melanoma is one of them, acquire very high mutational loads, so that when we sequence the entire genome, that we see that there may be tens of thousands of mutations that occur in melanomas, whereas if you look at a breast cancer, it may only be a few dozen. So there are many-fold more mutations in a melanoma. We believe it's due to sun exposure, perhaps due to mechanisms of DNA repair that lead to these types of tumors to acquire more mutations. Now the problem is are the mutational significant? Are they driver mutations? Are they the mutations that actually make the tumor grow, progress, and metastasize? Or are they just along for the ride? Are they passenger mutations? And that can be very challenging. So a molecular biologist might look at the mutation and say, well, is it in an important gene? Is it affecting the function of the protein? Does it make biological sense that this mutation could explain the progression of the tumor? So a mutation that activates a tyrosine kinase would make sense. That must have something to do with the tumor. Whereas a mutation that might inactivate a keratin, say, well, that doesn't really, I don't understand how that might drive a tumor. Now, as we go forward, we'll probably, in a molecular lab like mine, we can screen for all of these mutations, and we'll probably have a tier system saying these are tier 1 mutations, BRAF, NRAS. There's clear evidence that they're linked to clinical trials, to therapy, to outcome, to prognosis. And then there'll be a level 2 saying, well, here's ones that might be related. They seem to be important pathways. They might be involved in the biology. They might be considered, if a trial is emerging, that you might act on them. And then there might be level 3, where we don't know what these are. We've detected them. They don't seem to be in functional areas. What do we do with them?